Telemedicine providers are required to be licensed under the Healthcare Services Act, or HCSA, and comply with requirements and standards. In the case of healthcare, medical practitioners themselves also need to adhere to the ethical and professional standards set out in the Singapore Medical Council's Ethical Code and Ethical Guidelines. Under the guidelines, they must obtain sufficient information from their patients, conduct appropriate clinical assessment, and ensure that any provision of medical care, prescription of medicines, and issuance of medical certificates are justified on proper medical grounds. In other words, the regulation of telemedicine is not different from regulation of all other economic activities. We set standards, we require licensing, we conduct periodic audits for each clinic, investigate complaints, and take offenders to task. Such regulatory frameworks cannot eradicate offenders. That's not possible. But instead, it ensures that when practices have gone astray, especially with the advent of new technology and business models, they can be corrected promptly. And this is exactly what happened with the Mana Doctor case. The doctors were issuing medical certificates in a way that fell foul of HCSA, and MOH had made known our intention for Mana Doctor's outpatient medical service license to be revoked. Several doctors also appeared to have breached the SMC guidelines and are therefore referred to SMC for further disciplinary actions. And I think when we have new technology, we have an opportunity to make service better, to serve patients and residents better. But just like all new technology and all new business models, someone will try to abuse. And then questions will be raised. Is the ministry stepping up audit, enforcement, regulation, clamp down? And there's always a temptation to do so. And then when you do so, you cease, you stop being able to seize the opportunities that new technology can present you. So that is why I want to be quite honest with members. I think the current requirements and standards are valid, and our enforcement has been effective. So something gone wrong, we corrected it straight away. Mana Doctor has been notified. Their outpatient license will be revoked. Yeah, now is still the period for them to appeal. So I think it is by good enforcement, following up on our standards, enforcing them, taking necessary actions, then we can fully utilize and leverage opportunities that new business models and technology can offer us.